One condition that responds really well to shockwave therapy is plantar fasciitis. Plantar fasciitis is when the plantar fascia on the bottom of your foot gets really tight, and where it attaches on your heel, when it gets tight, the tightness pulls on that tendon where it attaches, and it causes pain and inflammation when you're walking, when you're getting up out of bed. It causes that sharp like pain right in the heel. The pain can also be felt in the arch of the foot as well. But what's great about Shockwave is it can get deep into that tendon to help break down any scar tissue and help to loosen up that tissue so it can repair itself. It also is very avascular in that area, so the Shockwave brings a lot of blood flow into that tissue, which can help it repair itself and heal. What we're going to do is I'm going to do a typical treatment for plantar fasciitis. The first part, what we're going to do is we're going to focus on the muscles above the foot, and so the calf, the gastroc, the soleus, all those flexor muscles in there, which can contribute to plantar fasciitis. We're going to work them first. Then what we're going to do is we're going to target the tissue in the foot after that to help break up any scar tissue and help heal that tissue. So let's demonstrate what a treatment to the calf looks like first, and then we'll work on the foot. Now what you're gonna hear while we're doing this treatment is you're gonna hear some tapping. And what that is a piston inside this handle that is going up and down, and then it's striking the headpiece. And what that's doing is it's producing a mechanical pressure wave into the tissue, which is what helps to break up any of that scar tissue, any muscle adhesions, or any trigger points in there. So it doesn't necessarily hurt. What it's gonna feel like is a dull ache when I get it over an area that's really tight. Normal muscle, you really wouldn't feel a whole lot, you'll just feel a little tapping, but over the problem spots, you'll feel a little dull achiness in that area. Same thing when it goes to the foot, we'll work the normal tissue, you'll feel a little tapping, and then we get over an area there it's a problem, you'll feel a little dull achiness, and that's breaking up the scar tissue and the adhesions. So we're just going to treat the whole lower leg here. We're going to treat the gastroc, the soleus, all the flexor muscles in this area, which will help to break up any of those adhesions in here. The treatment again is very tolerable. You will just feel a little dull achiness over any of those affected areas. After the treatment for 1 to 3 days, you may be a little sore in the site where there's a problem, but then it'll feel really good. You'll feel like you have more mobility, less pain, and more range of motion and function. Okay, so now we finished treating the gastroc and the soleus and the muscles in the lower leg. Now we're going to switch treatment heads, and we're going to actually treat the tendon and the plantar fascia on the bottom of here. And again, what that's going to do specifically is get deep into those areas where our hands can't get. It's going to break up any of the adhesions and scar tissue in there, increase the blood flow, and help promote healing. So now what we're going to do is we're going to treat the plantar fascia on the bottom of the foot. We're going to treat the whole belly of the muscle from the arch all the way into the heel itself. Now typically the problem area is right in the heel here. That's where patients will feel a sharp pain there. And with our other modalities, it's been tough to get to that area. It's a really thick, dense tissue. Well, the shockwave therapy gets really deep into that area to help get to that area where our hands can't get, or any of the other tools. So we like this a lot. We often will do Graston technique or active release technique first on the tissue, and then we'll do shockwave, and finally we'll follow it up with laser therapy at the end, which will help to decrease any of the irritation, also help to increase the blood flow and speed up the healing process. But let's demonstrate what this is going to look like on the plantar fascia. So again, we're starting all the way from the arch here, and then we'll just work our way back. And often this line right here is tight on a lot of people. When we go over in that area, it will feel a little dull, achy. And then the normal area, you'll just feel a little tapping. You won't feel a whole lot, but on her, like this inside portion is a little bit tighter. So that's where we're working there. And then we'll work all the way back to the heel here to get deep into this area here. It typically takes about 2 to 3 minutes for each area. So we've already treated the calf, and now we're going on to the actual plantar fascia. So again, 2 to 3 minutes on that area to get in there, break up that adhesion, the scar tissue, and to help get the blood flow for healing. So that's what a typical Shockwave treatment looks like when we're treating the actual plantar fascia. Treating both the calf and the plantar fascia together helps, again, loosen up all that tissue and help to loosen up any scar tissue adhesions that may have formed deep in that tissue there. So that is what a typical Shockwave treatment looks like when we're treating plantar fasciitis. Now, Renee, what did that feel like when we were treating the actual bottom of the foot? How would you describe what that felt like?
The tapping part actually felt a little bit like a massage as you were going up and down. I did feel some achiness sort of radiating out deeper inside my foot, but it was not a very painful process at all.
Yeah, when we get over, again, those affected areas that have the scar tissue that are thicker, you will feel some achiness. Like Renee said, you may feel it kind of radiating out, and that's essentially where that scar tissue radiates out from. And again, this is just going to get deep into that area and break that up, and also help to loosen up any other tightness in throughout the plantar fascia. Really comfortable treatment though. Again, patients may experience a little dull soreness for a day or two, maybe up to 3 days. We just have them drink a lot more water, and that helps with any of the potential soreness. The nice thing is there's no other negative side effects. A little bit of dull soreness could be the biggest side effect. It's very safe, very effective treatment, and works very well for treating plantar fasciitis. So if you're suffering from plantar fasciitis, give our office a call at 703-912-7822 or schedule online at novacarewellness.com.